Hello everyone, so welcome to part 4 of our NEET PG counseling series. In this video, we'll discuss ophthalmology as a branch for your NEET PG counseling. And I'm very excited to introduce Dr. Vineet Sehgal, who is also my senior from AIMS. He did his MD in ophthalmology from the prestigious RP Center at AIMS New Delhi, followed by his senior residency there, and is now a very well settled practicing consultant in New Delhi for the last 10 years. So welcome, Vineet sir. It is so nice to see you after such a long time and to have you on my video.
Pleasure is all mine. So it's ages. So seeing you as a MBBS student first year to now as a person who is making so much of impact. What I think, Rishabh, is that the purpose of life is to make an impact on others. It's your life, and how much you can impact on others' life, that basically makes the difference. So I'm so happy for you, and thank you very much for inviting me here. Just a brief introduction. I am Dr. Vineet Sehgal. I did my post-graduation from RP Center, and then I did my fellowship in glaucoma. Right now, I am practicing as the head consultant in Sharpside Group of Eye Hospitals in the unit of glaucoma and neuro-ophthalmology. And I am basically I am something which is a passionate teacher. What I think is that a person should be a student for lifetime and teacher for some moments. So learning so much things every day, and it feels so great that if I can impact some of you, and if you can get anything which you can benefit from me, that basically makes my day.
Thank you so much, sir, for those kind words for me. So we'll just start right away with ophthalmology as a branch. And as an MBBS student, most of the colleges don't have a very good rotation in ophthalmology. मतलब एम्स में भी ऑफ्था बच्चे कहीं जाते हैं, आर ऑफ्था के लेक्चर्स भी अच्छे से नहीं लगाते हैं, तो कुछ आइडिया इतना होता नहीं है लोगों को ना कि ऑफ्था है क्या. तो फर्स्ट ऑफ ऑल टेल मी कि ऑफ्था, what mystery is this eye, what all entails in ophthalmology?
Basically, Rishabh, what is happening is that yes, if you say that in the core clinical branches, you basically see medicine, surgery, ops, gynae, pediatrics, and then comes the third year subjects like ENT and ophthalmology. So now ophthalmology is something which is a very specialized subject. The thing is that you are a radiologist, you can take care of some bit of orthopedics, some bit of medicine. But if I talk about the ophthalmology, it is a different altogether. Even our ultrasound and everything, it is totally a different ball game. So yes, ophthalmology as a subject, it basically for an undergraduate, you need to know only basic things. I don't expect. I'm talking about the clinical things that you should know when you are passed out with the MBBS and you are intern. You should know about the basic things. I don't basically expect that you should know about the management of the complex disorders. But the best thing about ophthalmology right now is the expansion of its reach. As you are seeing, we are a lot of on our mobiles and our laptops, and the usually when I was doing my post graduation, 2 out of 10 UGs were having glasses. Now I think it is vice versa. Only two of them are not having glasses, and most of them are wearing glasses. So a lot of scope for LASIK as well, lot of scope for the glasses as well. So if I talk about the economics, the percentage increase, I would say, per year for the ophthalmology segment, that is something which is unbelievable. You must be seeing a lot of lens card and a lot of startups which are basically concerned with the only glasses. So that means, and when there is more glasses, there would be more refractive surgery as well. So the scope of this branch is very high, and I think it gives a lot of impact. What I will always say, impact. So if you can basically make a person see better, it would definitely increase his or her efficiency, and that's what ophthalmology is all about. Now it is not just a terminal branch, something which is a more specialized branch with fellowships and MCH in almost all the segments of the eyeball.
राइट सर. तो फर्स्ट ऑफ ऑल राइट ऑफ द बैक क्वेश्चन, जो कि बहुत कॉमन मिसकंसेप्शन या आई डोंट नो इफ इट्स अ फैक्ट कि ऑफ्थैल्मोलॉजी सैचुरेट हो गई है. देयर आर टू मेनी ऑफ्थैल्मोलॉजिस्ट पासिंग आउट नाउ. ऑफ्थैल्मोलॉजी में जॉब्स मिलनी मुश्किल है. सो प्लीज शेड अ लाइट ऑन दिस.
ऋषभ, एक चीज जो तुमने बिल्कुल सच भी कही और गलत भी कही, वो यही स्टेटमेंट है. 15-20 years डाउन द लेन, जब मैं ऑफ्थेल्मोलॉजी, जब हमारी ऑडिटोरियम में वो होती थी, काउंसलिंग होती थी, तो हमें याद है कि उसके बाद 40 रैंक के बाद तो फिर हमारे पास यही ब्रांचेस होती थी। अब मैं जो इम्पोर्टेंट चीजें जो लास्ट 10-15 ईयर्स में चेंज हुई है, सबसे इंपॉर्टेंट चीज है कि ऑप्थेल इज नॉट नाउ अ टर्मिनल ब्रांच। अगर हम अभी भी बोलें कि रिगार्डिंग द कैटरेक्ट्स and the lasix and the general ophthalmology, I would definitely agree with you that it is now something which is more saturated. Even if you throw something like a stone, you would get an ophthalmologist around. So that is absolutely true. Now the second thing what I would tell you here is that um, because of the longevity, now we have more increased age. We are basically doing the surgeries even at younger age. We can basically remove the glasses at any point of time more than 18 years of age, and we have diabetes all around the world. So I would say that in the community, the number of patients of ophthalmology, every home has a patient of ophthalmology. Even in your home. So they would get a cataract 100%. They might not get a joint replacement in their lifetime, but 100% they would get a cataract. Child would need to get eye checkup done. So every household. So if I talk about India, so we have around 140 CR people. So out of them, 100 CR would need something like an eye intervention at least once a year. Now remember this point: 100 CR. I am in a corporate hospital. I take care of the footfall and everything. So even if we are producing lot of eye specialists, there is a dearth of the good eye specialist in India. If you basically tell me कि Dr. Vineet, I am referring you a person, I would straight away give a blank check and say कि यार बता कितने में तू आना चाहेगा. That is the right now the situation. There are a lot of eye chains which are going up. The number of eye hospitals has increased like anything. So you would get definitely a good job initially, and when you basically start up after 5 years down the lane, you can basically do something like a consultancy work also, and you can start your own practice. There is nothing called saturation for good eye specialist.
Okay, sir. So first, let's talk about the subspecialties that are there in ophthalmology. So you mentioned earlier that ophthal is no longer an end branch. So let's first discuss what are the subspecialties, and among these subspecialties, which are the top subspecialties chosen by the medical students.
Definitely. Now, there are two things, Rishabh. One thing is the financial scenario. Now, मैं हमेशा ये बोलता हूँ कि पैसे का काम पैसे से ही होता है. और पैसा is the very important. जो आएगा आप लोगे, so okay, you would say कि Dr. Vineet, I would do a lot of impact and everything, but how much I would earn? So यहाँ पर जो सबसे अच्छी चीज ऑफ्थेल में हुई है कि as soon as you go into a subspecialty and you are done with the fellowship or senior residency or whatever it is, you easily get a job which is almost equal paying as compared to something like a DM. Now this is a very big statement. Why I am saying this statement? Because these numbers are very high. Maybe the number of cardiac transplants or everything or angiographies, they are less, but the ophthal surgeries, even minor surgeries, lasers are very high. So what are the subspecialties? So first subspecialty is the cataract. We all know it is not a subspecialty, it is bread and butter. But now the cataract has become a subspecialty because now we are basically, it's not a cataract surgery, it's a cataract refractive surgery. We remove the cataract as well and we remove the glasses as well. So this is the first, the bread and butter of the ophthalmologist. Now, second thing is something which is called refractive. Refractive means removing the glasses. Removing the glasses, LASIK is something which is going in a big way. Rishabh, I can just give you an example. In 2 minutes, you can basically remove a glasses and you can charge 1 lakh rupees. Now, in 1.5 or 2 hours, you would do something like a bigger surgery. You won't charge 70 or 80 lakhs. So see, an ophthalmologist, a practicing ophthalmologist, if he does around 15 to 20 LASIKs per day, so can you just calculate it? Around 15 to 20 lakh rupees
Economies of
per
scale, volume बहुत ज़्यादा जाती है.
it is enormous scale. It is enormous. So LASIK refractive is the second subspecialty. Then comes what is now basically being sought after maximum, that is retina. Now, why retina? Because everyone is diabetic and now we are getting diabetic retinopathies, hypertensive retinopathies, ROP, and everything is there. And because now it is something which is not only surgical. Now everyone says how much cutting. Now it is not the way now. So it's not about the cutting. Now ophthal is about medical, ophthal is about surgical, and ophthal is about diagnostic. can you basically expect, Rishabh, every day I am doing 20 CTs myself and 7 to 8 ultrasounds. Now, this is the number of diagnostics that I am doing.
Hmm.
So that is the power of retina, because retinal edema, cystoid macular edema, you all must be knowing about that. That is very prevalent. This is the retina. After the retina, the next specialty is glaucoma. Now, I am a glaucoma specialist. What happens in glaucoma is, once there is a patient, he always remains a patient. So, like an endocrinologist, he can have one patient for the lifetime. Similarly, if I say ARP is the per patient, how much money he's going to give me in a year. So, if I basically say, if a person has a 10-year or 15-year life duration, so for 15 years, he would be always seeing me. Now, I am saying only 15, but it may be 20, 25, 30 years down the lane. So, see, even if one or two new patients you see per day goes to around 1 lakh per day. Okay. So, that is the power of glaucoma. Then there comes academics. If you say that, sir, I am basically not concerned with the all this, I do want something which is a core academics. It is neuro-ophthalmology. There is a specialization in neuro-ophthalmology, and I think the radiologists know it very well.
Yeah.
If you can basically detect something very early by a visual pathway defect, you can even save life. So
Hmm.
neuro-ophthalmology is another subspecialty, and then comes the pediatric ophthalmology. So we have pediatric squints, we have basically adult squints, and we can have these glasses and all these type of disease. So this is the last subspecialty, pediatric ophthalmology. I would definitely say pediatric ophthalmology and neuro-ophthalmology. If you say about the financial terms, it is not as
Reward.
lucrative as it is a cataract, refractive, or retina. But yes, we have a lot of fellowships in that also. And the best thing is that you can get fellowships a bit more easily as compared to other branches.
So now let's talk about fellowship since we are on the topic. So let's say somebody has done his or her MS in ophthalmology. Now he wants to subspecialize. So number one, what are the options in terms of fellowships, MCH, or going outside India? Number two, what are the good institutions in India to do such fellowships?
So, very nice question, Rishabh. So, first thing is that all the big eye hospitals. Now, the problem is that in other specialties, it is usually the government big institutions that have the subspecialties. Often subspecialties are there in lot of private hospitals. And there are some hospitals, like you must have known about Shankar Netralaya, LV Prasad Eye Institute, Arvind Eye Institute. These are the world masters. So after you complete your post graduation, you have a lot of options. First thing is senior residency in AIMS. It is almost equivalent to fellowship, even if not better than that, because you get exposure of your specialty as well as for other specialties also. This is senior residency. You can get in any of the AIMS. PGI has that, JIPMAR has that, and most of the big institutions, Guru Nanak Eye Center, have that. Now we come to the fellowships. Fellowships are there almost in any big eye hospital, and these fellowships are usually of 1.5 to 2 years. In some cases there are long term fellowships of 3 years also, and some cases there are short term fellowships of 1 year and 3 months and 6 months also. So it is usually not very difficult to get into a fellowship of the specialty of your choice. Yes, it takes around 1.5 2 years more to get your super specialization.
Okay, sir. So after you are done with your MS, you're done with your fellowships. So what are the starting salaries? Because first generation doctors, they usually don't have or may not have such backup to open their own center, or
No,
they
definitely. And even Rishabh, I would say, even if they have, they should not.
they
The
should.
reason is you should basically see what is the market need, what
Mm.
are the various things which are going on. So even if you have that, I would say that initially start for 3 to 4 years or 5 years in the competitive field, get exposure, and then go for the final thing.
So what are the starting salaries that one can expect at after a fellowship?
So there are two things. One thing is now it is more of a supply and demand rule.
Mm.
Now, if you say tier one cities, tier A cities, they usually have a saturation, and the packages are a bit less. I would say around 1.5 to 2. That is the starting salary of a fresh person who has done a fellowship or senior residency here. Now, it can be higher in the cases where there are tier 2 cities, and let's say if they have 5 cataract specialists and they want a glaucoma specialist, so they would be definitely giving higher thing to the glaucoma specialist, because that basically fills the very important gap. But usually it starts with 1.5 to 2. In the case of retina or glaucoma, if you need more in tier 2 or 3 cities, it can be up to 2 to 2.5. Now, this is something which you start with, but I would say that within a year or two, you can get around 10 to 15% raise very easily.
Okay. So this was regarding the finances. Now, sir, very important question I want to ask you personally as well. Like choosing between a private practice and sticking to a hospital-based practice or a eye chain, what are the pros and cons with all these three options?
Now, the problem with the ophthalmology, as an ophthalmologist, I would say what are the problems that I face in last 10 years.
Hmm.
So first of all, we know that जैसे मैंने बताया कि पैसे का काम तो जो है हमें पैसे से ही हमारा होता है. So the investment is very high. So let's say if I want to basically start a setup as a person, so I would need a phaco machine, I would need a good microscope, I would need a good OCT setup, I would need a good laser. So even if the basic setup is needed, I am saying that even if a basic setup is needed, it basically cost more than 1 CR. So more
कितना
than 1 CR
more
is
than 1 year is
the
कितना?
it is the starting point. Now the problem is that now this amount of money, and if you basically see 1 CR as an investment, you want 10% as a return just to maintain it.
Hmm.
I'm not saying so 1.1 CR per year you want to just basically go through the crisis. You are not earning anything. So that's why initially I would say, unless otherwise you have a good corpus, which is something which is there, setting a private practice is difficult for 5 years.
Hmm.
Now, the second problem is if you basically start a private practice in front of my hospital. Now, we are in Delhi, Preet Vihar. We are having 5 eye hospitals. So, the patient would definitely go to that doctor who is more experienced. He would go to that doctor who would have more parking space. He would have all the doctors. Let's say if I need a specialty, if I need a glaucoma cross consultation, we have 5 doctors or 7 doctors at one place. You want a end point solution. Don't you want? You want everything. You want optical on that area as well. You want pharmacy on that area, because ophthal is not something, it is just a surgical. It is surgical, diagnostic, and medical all. So setting a private practice, a complete end-to-end private practice, requires a lot of money. Second thing is, now the patients want, in Indian scenario, the patients basically want someone who is more experienced, and they basically go by name. So initially it is difficult to basically start. Once you make a name in a corporate sector, let's say I am for 10 years in a corporate sector, then I can say, okay, I am doing a something like a freelancing, and I have a small OPD setup that does not require too much of investment. And then slowly I can build a hospital where I can basically do some services as a outsourcing, and rest things I can do in my hospital. So that is slowly and slowly you build up, because the corporate chains have a lot of foreign investment. I told you Ofthel is something, the glasses and all. So a lot of players are coming as a foreign investors, and the investors here, we are in this area where the funding has dried, but still you are getting around 1000 CR as just a funding for the hospital. So it's difficult. It's very difficult to open a good eye hospital in a place which is a tier A or tier B city.
So for someone who is belongs to a tier 2, tier 3 city and he has done his MS in Ophthal and maybe a fellowship or 1 or 2 years of senior residency, what is the starting corpus he or she is looking at to just start off? You mentioned one C.
I would say at
One.
least 50 to 75 CR. Oh, sorry, 50 to 75 lakhs.
Okay, that is the amount of money. And
That
what?
is the reason is that you want a good microscope, you want a good phaco machine, and you want some basic setup. Now, I am not basically calculating the price of the hall, the rentals and all that stuff. I am just talking about the stuff which is concerned with the ophthalmology treatment.
And what is usually the what do we call it in finance? मतलब return on investment कब तक आने लगता है?
ROIs. So there are two things. One is ROIs and one is EBITDA. So ROIs is return of investment. So any chain, if you are a something who is a retina specialist or who is a glaucoma specialist, where the major thing is your diagnostics, your lasers. I basically do around more than 100 lasers per month for my glaucoma patients. So here you would say around 4 to 6 times of your salary. That is your usual ROI that you expect. Uh, in cases of cataract and LASIK, where the investment is more high, you basically see it around 8 to 10 times of your salary. That is something which is the ROI that you expect. And anything which is the earning, uh, if you are getting a profit of around 10 to 15% after 2 years of 2 years of operations, that is basically expected as a good EBITDA. EBITDA is
Yeah.
earning before income tax deduction and all that.
अच्छा, so थोड़ा initial investment ज़्यादा है and the profit margins usually range between 10 to 15%, maybe 20%. This is the usually profit
Uh,
margin.
this is I'm talking about corporate, yeah, but person, but I'm basically taking care of that area also because you have done a lot of investment. So
Hmm.
that's why the initially your profit margins are lesser, or I would say earnings are less. But as you grow, it can go to around 5 years, 10 years down the lane. We have chains which have around 60% EBITDA. 60% means that you basically, if you have invested 100 rupees, you are getting 60 rupees as a profit.
So, sir,
That is profit.
yes. So, sir, final question before we wrap up. I think very, very interesting talk going right now, and I'm sure it is helpful to all the residents. This final question: if someone is choosing Ophthal program, which are the pointers that he or she should keep in mind in that particular hospital?
Okay, so first thing is that or there is nothing called MS or DNB. Lot of students, because I am right now getting a lot of questions that, sir, should I go for an MS or should I go for DNB? DNB in a good hospital is equivalent. You should go to that hospital. It's not just about cutting. It should have all the specialties there. You should have some experience of even if you are a cataract person, you should have some experience of retina, glaucoma, and other specialties as well. Third thing is you must have good exposure to the surgical programs. Even if the cutting is not there in the first or second year, it doesn't make a lot of difference. In the third year and in the fellowships, you and observation, you definitely get that. So always see what is the infrastructure of that hospital and then basically decide for that. And for Ophthal, if you think that the financial thing is something which is more important to you, I would say that this is not a very good brand because there is something which is a stagnation after some time. So there are some ifs and buts, some exceptions can be there, but the salaries in the corporate sector as well as the earning in the private sector, they do not go above the roof. So if you are very passionate about ophthalmology, only then you basically opt for that. Otherwise, if you think that I am more okay with other branches, definitely go with that.
So I think it's the same
It
in
is something which is more of a passion.
I think it's same for radiology as well because in radiology the starting salaries are a little higher than the other, but there is a cap beyond which your salary, especially in a hospital-based setup, do not increase, and this is true for diagnostic radiology. And I think the same is the case for Ophthal as well.
Definitely, definitely. And second thing is, but yes, definitely the radiologist would earn a bit more than an ophthalmologist. That is there. But yes, the stagnation becomes very early in a case of ophthalmologist as compared to a radiologist. Because the thing is, we are having a lot of ophthalmologists now, and the results are almost comparable because it's not the surgical skill that is basically increasing, it's the technology that is increasing. Yeah.
Okay, okay. So it is also a very tech dependent, tech heavy branch.
It's very tech dependent, and just remember, it's not just a core surgical branch.
Hmm.
And if you are a good ophthalmologist, I would be the first one to pay a blank check to you.
Okay, sir. I think that was a really nice discussion for me as well because ऑफ्था का MBBS में ज़्यादा कुछ पता नहीं होता है. The financials, nobody knows about it. So thank you so much, sir, for this very crisp, high-yielding video of yours. And I hope the students benefit from this. If you have any queries, please mention them in the comment section. Both of us will be very glad to assist you in this. Any parting words, Vineet, sir, from your end?
Bus, the thing is that, my dear friends, my dear student, I think Rishabh knows me from last 12 years or 13 years, if I think so. Just this field, now we are seeing that some disturbances in our field, in medical field, but I would say that being in corporate sector for last 10 years, being in edtech, the one who started the edtech in 2014 15, it's really nice to be a doctor. It's really nice to be seeing someone getting the vision back, or seeing someone restoring the vision or preserving the vision. So if you are a passionate person, this is the field that you should be. And if there is nothing, डॉक्टर कभी भूखा नहीं मरता, पहली चीज, ठीक है। ये कभी भी नहीं है, हमारे यहाँ रिसेशन कभी नहीं आने वाला, जो बहुत ज्यादा रिसेशन होगा कि उसमें होगा। हाँ, डेफिनेटली ग्रोथ कर्व कैन डिफर, but if you are passionate about your field and about the work you do, there is no one who can basically stop you. And all the best। और जो भी करो यार, कभी भी जो आपको मनी या कोई चीज होती है, सक्सेस होता है ना, ये बाई प्रोडक्ट ऑफ द वर्क दैट यू डू। सो थिंक अबाउट योर वर्क फर्स्ट, योर पेशेंट फर्स्ट, एंड रेस्ट एवरीथिंग वुड कम। बी एश्योर्ड, हम लोग 10-12 साल से साथ में है। इट्स ऑल अबाउट, जब आपको देखना है तो पैसा हमेशा एक सेकेंडरी रखो। हाँ, बहुत इंपॉर्टेंट है, बट दैट शुड नॉट बी योर फर्स्ट थिंग दैट यू बेसिकली काउंट अपॉन टू गो फर्दर इन योर कैरियर।
Thank you so much, sir, for those wise words. And even I say, a lot of students ask me कि sir, रेडियो ले लूं क्या, मेडिसिन सोचा था, मेडिसिन अच्छा लगता है बट रेडियो ले लूं क्या। मैंने कहा नहीं, मत लो। ठीक है, रेडियो में बोर हो जाओगे, 1 साल ठीक लगेगा, उसके बाद रेजिडेंसी यू स्टार्ट हेटिंग इट। सो बहुत जरूरी है व्हेन यू स्टार्ट चूजिंग मेडिकल स्पेशलिटी दैट अगर कुछ पसंद है तो भाई वही लेना है। मतलब इट इज एज सिंपल एज
हाँ,
दैट।
बिल्कुल। और पसंद तो आ ही जाए, जब काम करना शुरू करोगे यार, धीरे धीरे हर चीज पसंद आने लग जाएगी।
सही में सर, सही में। Thank you, sir. With that, we'll finish our video. Thank you so much for watching this video. If you like this series, please continue watching it and hit the subscribe button and the bell icon button. Thank you, and I'll see you in the next video.
चलो, ओके, थैंक